Hi, this is Molly, and I did acute kidney injury for my monograph presentation. I thought this topic was interesting because the patient that I cared for would drink about 5 to 6 alcoholic drinks every day, and I wanted to learn more on the effect of alcohol and what it can make on your body long term. My patient arrived by themselves to the emergency department. She has a history of alcohol abuse. She states that she has had nausea and vomiting for the past 2 days and was trying to detox at home, although she had her last drink 3 hours before coming into the emergency department. She has had a history of seizures and claims she is depressed but not suicidal and drinks 5 to 6 drinks a day. Her CT scan showed that she has an enlarged liver with diffusely dense appearance concerning that she has fatty liver disease, and it also causes nonspecific inflammation. This is also highly associated with excessive alcohol consumption. The CT also showed hydropic gallbladder with diffusely dense appearance concerning for significant sludge retention, which is built up on the gallbladder for too long, such as bile staying in the gallbladder. Here are her lab findings. You can see that her sodium is low and she was diagnosed with hyponatremia. Staging for acute kidney injury is based off of serum creatinine level and urine output. Listed here are the medications that she was currently prescribed while in the hospital. The folic acid is needed for the production of red blood cells, and a therapeutic response of this is increased weight, oriented, and absence of fatigue. Magnesium oxide increases osmotic pressure and draws fluid into the colon. The therapeutic response for this is decreased constipation, absence of seizures, normal serum calcium levels. Thiamine is needed for pyruvate metabolism and carbohydrate metabolism. The therapeutic response for this is the absence of nausea, vomiting, anorexia, insomnia, tachycardia, depression, and muscle weakness. Lorazepam is a PRN for anxiety every 3 days. This depresses the subcortical levels of the central nervous system, and the therapeutic response is decreased anxiety, restlessness, and sleeplessness. Acetaminophen is also PRN for pain, and she can take this every 6 hours. Acetaminophen may block the pain impulses peripherally, and the therapeutic response would be absence of pain. So looking at Mosby's evidence-based monograph, acute kidney injury is a sudden decrease in renal function over hours to days that may or may not result in long-term reduced kidney function. It is usually seen as a syndrome and not by itself, meaning that it is usually part of a bigger organ dysfunction and does not have a single cause. There are 3 types of acute kidney injury as subtypes. The first one is prerenal, which is caused by decreased blood flow to the kidneys. Examples of this are severe injury leading to blood loss and surgery, severe dehydration related to burns, and other causes of fluid shifts such as cirrhosis. The second one is intrinsic, which is damage to the kidney tubules or intrarenal blood vessels. Examples of this are caused from an infection or hypertension. And the third cause is postrenal, which is obstruction due to cancer, kidney stones, or blood clots. AKI is the most common organ dysfunction in critically ill adults. Although treatment is available, AKI puts patients at a great risk of further renal damage and death. Looking at the current practice, as mentioned before, AKI is staged by urine output and serum creatinine. It is very important for nurses to monitor input and output for the patient because you want to keep the patient hydrated, but you do not want to put too much fluid into them so that they would go into fluid overload, and the nurse should look for signs of peripheral edema to ensure this is not happening. Blood pressure is very important for these patients, and they should have a mean arterial pressure goal based off of their medical history that they want to stay within that range. They also need documentation of their electrolytes frequently so the healthcare team can notice a change in either direction with these, which may indicate worsening. Nutrition is important in patients with AKI as well as monitoring their blood sugar to prevent hypo and hyperglycemia. NSAIDs can cause damage to the kidneys by decreasing blood flow, damaging the tubules, or causing postrenal papillary necrosis. These should be used with caution in patients with AKI. Patients should be kept NPO for the shortest allowed time before surgery if they have AKI. They will also require close monitoring before, after, and during surgical procedures. Patients with AKI are at risk for developing more kidney dysfunction and chronic kidney disease. So this patient was diagnosed with acute kidney injury upon being hospitalized, and they fall under the category of the pre-renal because there is a shift of fluids happening, such as cirrhosis. This is caused by the patient's excessive drinking and damage to her liver. Acute kidney injury is also seen with a change in electrolytes. This patient was hyponatremic, which most likely resulted from her alcohol abuse. Vomiting and increased urination can be side effects of alcohol abuse and lead to hyponatremia. This occurs when there is an imbalance between water and sodium in the body, which results from the patient being dehydrated. As listed before, the medications the patient was taking are related to treating acute kidney injury, along with the side effects from alcohol withdrawal, and help with seizures, fatigue, vomiting, and generalized weakness. One article that was mentioned in the monograph looked at the effect of NSAIDs and their risk of causing AKI. So this was a level of evidence 4, which means it is a well-designed, case-controlled, or cohort. This article looked at 30 days of patients using NSAIDs to determine the risk of acute kidney injury. This study's cohort was from Ontario with similar baseline health to make it more valid. Those who used the NSAIDs had a higher risk of developing AKI versus those who did not use the NSAIDs for 30 days. They did conclude that prescription NSAIDs may be safer than over-the-counter, but to still use with caution. The next study that I looked at the costs of AKI versus non-AKI illnesses. This was also a level of evidence 4. This study looked at the costs associated with acute kidney injury in the hospital and ways to prevent further complications or reoccurrence. The longer an individual is in the hospital due to acute kidney injury, the more money it will cost, including for the hospital. Inpatient AKI affects an estimated 498,000 patients in the United States. One study looked at patients with AKI compared to other common acute conditions for the cost. Those patients with AKI needing dialysis cost a lot more money than those without AKI. The purpose of this study was to show that not treating AKI correctly and efficiently early on will most likely lead to the patient needing dialysis and becoming more expensive. Looking at the evidence-based nursing recommendations, assessment is all about questions on history and current health. Assessment is the biggest key factor for AKI patients. This should include asking about nephrotic medications, history of kidney disease or dysfunction, fluid volume deficit or overload, increased age, diabetes, hypertension, and cardiovascular disease. Patients scheduled for cardiac surgery should be asked about smoking history, hypertension, and changes in renal function. Dialysis and data analysis. The nurse should review trends in intake and output for the fluid balance and monitor blood pressure. They should also monitor creatinine and urine output to their baseline and report any changes. Planning and implementation. Promotion of hydration should occur at all times when able to. The nurse should also promote nutrition as an intervention. For discharge, the nurse should educate the patient on hydration, nutrition, signs and symptoms of worsening kidney function, and appropriate follow-up care. In this case, the nurse should also suggest limiting the alcohol consumption since it is playing a big role in the patient's illness. For evaluation, the nurse should look at the patient's creatinine level to return to baseline and urine output within normal limits. The patient will be able to tell the nurse their understanding of acute kidney injury, including signs and symptoms, and when to seek medical attention. The patient will also agree to attend follow-up appointments. For the benefit to the patient, this monograph allowed me to better understand why my patient was diagnosed with AKI. It gave me information to educate the patient on what they need, on them needing to be kept hydrated during this time, but they should not overdo it and cause fluid volume overload, resulting in edema. The patient was prescribed acetaminophen, which is an NSAID. It is important to educate the patient on the allowed dosage to prevent further damage to the kidneys. One reason this may be happening to the patient is from cirrhosis to her liver. It is important she stops drinking alcohol due to the damage already done to her kidneys. In conclusion, AKI can come on suddenly or over time and is a sudden decrease in renal function. This may or may not result in long-term damage to the kidneys. It is diagnosed through serum creatinine levels and urine output. This patient also had an enlarged liver, which pointed toward acute kidney injury. There is treatment, but it is most important to start early on, or the disease will worsen and chronic kidney injury may